This video is going to go through some basic jump and hop progressions at around month 4 to 6 when doing ACL rehab. It is different from patient to patient. Some might be a little bit before, some might take even longer, so it is going to vary with every person that you treat. So we can start with some low intensity jumps, just using a frame of reference to start, such as some cones, but then we can slowly start to increase intensity, making sure that we're doing a little bit more of a length in the jump, just ensuring that the patient feels safe when they're landing and that they're feeling stable. We can also start clearing a reference point, and it could be just some cones on the floor, or you could start to stack up, not too high, but maybe some books to jump over. Then you could start to add in forward and back over that reference point. When we start introducing the back component, this is working on a little bit of proprioception for the patient. They're not seeing where they're landing, so it's looking to still keep things low intensity, get a little bit more unpredictability going on. Then we can look at some lateral jumps, and you can see the difference between just landing over that reference point to starting to do some consecutive jumps with only landing momentarily, and that will take a bit of time to get to, but it's just something to think about in terms of progressions. When you've started to increase the intensity of double leg hops, it could be an idea that patients could be progressed to something like a low intensity single leg hop forwards. Then once that's worked on, we can do a little bit of forward and back, aiming for that stable landing, aiming for the other limb not to touch the floor so the patient feels strong and stable on one limb. We can look at forward and back with a little bit more intensity. You could do something like a lateral hop and stick, where we're hopping laterally but aiming to stick it for a second or two, working on that stability. You can use something like a square as a reference to combine the forward and back and side-to-side movements. This can also be done in a north, south, east, west type pattern. Then if I lengthen the distance between the cones, it looks a little bit more like a rectangle, but we're working a bit more on the lateral movement rather than the forward back in this instance. It's important to remember some criteria for patients before they start continuing some sort of high level jumping type exercises. Ideally at this stage you want patients' range of motion to be full, no post-activity pain or swelling, 80% limb symmetry in strength testing throughout different parts of the limb, such as your hamstrings, your calves, your hips, your planks. One of the more important things is having some adequate knee extensor strength, and that could be in the form of a single leg sit to stand test, where we're getting patients to get as close as they can to 90% as possible when they're doing any type of knee extensor tests. However, it might be in the 80% mark at this stage. Bear in mind, these are quite simple exercises. There are going to be progressions to these. Additionally, check out the ACL rehabilitation playlist, where there is a lot of baseline measures such as triple hop for distance, single leg hop for distance, crossover hop tests, and lots of different other ones, as well as baseline measurement tests. These can also be used as exercises.